ear, nose, and throat specialist, Dr. Syed Ali. Welcome to the show.
Thanks, Bart. Thanks for having me on. It's an honor to be chatting with you.
Yeah, it's an honor to have you here. Your first time on our show.
Yes.
How long have you been with Henry Ford?
About 2 years now. So I started about 1.5 to 2 years ago, and it's been great working with the staff here and the patients in the community.
So ENT, that's how everyone says it because the real scientific name is impossible to pronounce.
Very long.
Yeah.
Hard to say.
How did you choose ear, nose, and throat for your specialty?
It's a good question. Going through medical school, you have the option of choosing one of a number of specialties. I was always sort of drawn to specialties where you work with your hands to help solve problems. So surgery was, a big interest of mine, and ENT has quite a broad range of applications for it. So from sinus surgery to head and neck cancer to sleep surgery, it allows you to dabble in a bunch of different fields and work with kids and adults. So I think the variety that it offers was what drew me the most to it.
Yeah, and everyone has ears, noses, and throats. So.
That they do.
And they're all connected.
Yes, yeah, it's quite a bit of interplay between your nose, your ears, your throat, and stuff. So, pretty complex area.
Yeah, I remember I went to an ENT specialist because I had teeth problems.
Okay.
And it was because no, it was teeth problems, but it was because I was getting earaches.
Oh, sure, yeah.
So even your mouth, your jaw, it's all...
Yeah, there are a lot of nerves in the area that go from one place to the next, so something could feel like it's causing trouble in your ears and actually be from a different part of your body. So a lot of complex interplay.
Well, today we want to talk to you about what is a very common issue that people experience, and that is sleep apnea.
Yes.
How many, roughly, percentage of people in the world have sleep apnea?
Yeah, great question. So as many as 20% of Americans, wow. Adult Americans, can have sleep apnea, whether it's diagnosed or undiagnosed, and the number continues to increase each year. So it's definitely a big problem. As many as 1 in 5 adults could have it.
That's a lot.
Yes.
And we were talking before the show, there's probably a pretty high percentage of people that have sleep apnea that either don't know it or they've been diagnosed with it.
Right, so yeah, so to diagnose it, you need something called a sleep study, or a polysomnogram in medical terms. So, many patients are probably going through their lives right now with, unrefreshing sleep or some of the symptoms of it without knowing that they have an actual problem.
What is sleep apnea?
It's a great question. So sleep apnea, or OSA as we call it, obstructive sleep apnea, it's a condition where when one goes to sleep at night, you try to take in air through your nose and your mouth. And in these patients, what happens is the extra tissue behind your tongue and in the back of your throat, it sort of gets in the way and causes a blockage or an obstruction. So when that happens, the air that tries to make its way down past that area into your lungs, it gets hung up there. So that area vibrates, which causes the snoring that we associate with it. And it also results in something called an apnea, which is where you have a temporary pause in your breathing. So people will sort of sometimes wake themselves up, startled, not getting enough oxygen. The short-term consequences of that is that people may get headaches in the morning, feel tired when they wake up, have fatigue during the day, and long-term it can cause a lot of heart and lung issues as well, unfortunately.
Yes. And so people think of, I just stopped breathing in the middle of the night, but can you die from it?
You won't die in the short term from it, but if you leave it untreated, it can shorten your lifespan, unfortunately.
Yeah. And do you always, like, the people that, they stop breathing momentarily, does it wake them up?
Not necessarily, actually. Oftentimes it's diagnosed by the bed partner. So your bed partner or people in the house may notice that you snore that goes through the walls. It's a common complaint. Or they may notice that they have these temporary choking and gasping spells while they sleep.
I can imagine that there are people that they don't want to get the diagnosis of sleep apnea yes. because of what's been the traditional treatment, the CPAP machine.
Correct. Yes, so CPAP, or continuous positive airway pressure, is the main treatment for sleep apnea. It basically does what it sounds like. So it's a device that you wear over your nose and your mouth typically, and it basically forces air past that blockage or obstruction in the back of your throat. So it allows oxygen to bypass that area, work its way down into your lungs, and hopefully relieve the obstruction. It works well for the majority of patients, but there is a small subset of patients who, for a number of reasons, can't tolerate it.
Plus, it's so disruptive. I mean, it's there, it's huge. I was at the airport a couple months ago, and the Delta agent at the baggage check-in counter opened up this poor person's suitcase and started pulling stuff out, and there's the CPAP machine.
Yeah. So you do have to travel with it and stuff because people become quite reliant upon it, obviously.
But good news, there's something new and improved that can treat sleep apnea that's not a CPAP machine.
Yes, so there's a company called Inspire, which I don't have a financial relationship with, but they create a device called a hypoglossal nerve stimulator implant, which is a mouthful. But the gist behind it is that there's a nerve in your neck called your hypoglossal nerve that actually pushes your tongue forward. And the idea behind it is that when the device is activated, the recepting portion of the device senses when you're about to take a breath in. It sends a signal to the implant that's around that nerve, and it tells it to push forward when you go to take a breath in while you're sleeping. And that allows that area to open up, it relieves the obstruction, and allows oxygen to bypass that area and work its way down into your lungs.
How big is this device?
It's really small, so probably a couple of millimeters in size. It's all buried underneath the skin, so nothing that you would see. But yeah, it's a small set of circuitry that goes from the area in your neck to a sensing lead just below your collarbone. And it works behind the scenes to help treat sleep apnea for the right criteria patients.
So smaller than a pencil eraser.
Yeah, about that size, I would say, yeah.
And then there's a wire that goes.
Correct, yeah. So the sensing portion of it sits below your collarbone in your chest, and it's next to a couple of the muscles next to your ribs. And that senses when you're about to take a breath in, and then it sends a signal through a wire that's in the implant around that nerve, and it tells it to activate. So then it pushes your tongue forward while you sleep.
Wow.
And then air kind of bypasses that area and works its way down into your lungs.
Can you feel it? Can you sense that something's going on?
It's a great question. So if and when the device is implanted for a patient, there is a lot of troubleshooting that has to happen to make sure the amplitude that's being delivered is comfortable enough for the patient. So if you have it at too high of an amplitude, they may have some discomfort with that. But if it's too low, it may not treat the problem. So you have to find kind of the right happy zone with it. So there is some troubleshooting involved. If you turned it on while you're awake, you would obviously sense it. But the hope is that once it's activated and you're sleeping, you wouldn't notice it, so it wouldn't wake you up.
Oh, so you have to physically, there's a
Correct,
switch.
yeah, it's actually a remote
Okay.
that you use that you can activate it with, yeah.
Huh. So it's surgery.
It is surgery, right. So there's a few different steps that you have to go through to get to the point where you're considering surgery. So all three parties involved, myself as a surgeon, the device, and most important, the patient. We want this to be implanted only in people who would benefit from it. So there are a set of criteria that you have to meet. Some of them are based off of your sleep study, which are just pure numbers. So you would have had to have a sleep study done within the last 2 to 3 years, depending upon your insurance. And then on the sleep study, there's a certain set of numbers that we look at. One is something called the AHI, which is a number that tells us how many times per hour do you temporarily stop breathing. And if that's in the right range, between 15 to 65, you meet the criteria. Most of the obstructions, so more than 75%, have to be related to the blockage in the back of your throat. So that's a part of it as well. And then there is a weight criteria based off of your BMI or your body mass index.
Yeah, so I wondered about that because
Yeah.
some people think, or maybe it's true, that your physical, your health, maybe your weight, you're overweight, that contributes to the sleep apnea.
It definitely can, yeah. So there are some people, who don't have that problem due to weight, and it's due to just the way their back of their throat and the back of their tongue is, but many people, the weight can be a contributing factor. So in those in whom your BMI is more than 35, they wouldn't qualify for the device unless we're able to get it down into that range. Just because we found that with studies, if we put implants in those patients, it may not work quite as well.
Yeah, so if your BMI is 35 or more, then maybe your issue is there's
More
some things you
weight-based.
should do first.
Correct, yes.
And
there are many patients who are right at the borderline. They may be 10 to 15 pounds off. So, I talk to them and say, hey, if we're able to get you down within that range, you definitely could be a candidate then.
And have you had people that lost weight and then, oh wow, the problem seems to have solved itself?
Yeah, if it is a substantial amount of weight, definitely. The trickier ones tend to be where you're just a few pounds off. So those don't tend to have too much of a change in their sleep apnea once that weight comes down, but it does put us in the range where we can go ahead and consider doing the operation itself.
Awesome. Well, I have a brother-in-law right now who's potentially a candidate for Inspire, but he's wondering if he needs to go through and try the CPAP machine first before he talks
That's a great question. So elaborating on my previous point, so that there are those numbers that you have to meet. If you meet those numbers, you also have to have a criteria of something called CPAP intolerance. So you need to have met with a sleep specialist, and you both would have agreed upon that, hey, I've tried a CPAP device, it's not working well for me for whatever number of reasons. I don't like the way the mask fits. I get an air leak, I get air hunger, I still have unrefreshing sleep. So if you have that documented in the chart, then that qualifies you to go to the next step in considering the implant.
Yeah, I can see a lot of reasons why CPAP might not work. Just having something on your head all night.
Yes.
And it's noisy too, right?
It's pretty noisy. It disrupts the bed partner sleep as well. So many people will continue at it because they don't want the troubles that it can cause down the road, but they'll have poor quality sleep and don't feel refreshed like they should. So those patients would potentially qualify as well.
Yeah, so that's the thing. People are alerted to potentially having sleep apnea is that they wake up tired.
Yes.
And it's because all night long they're waking up.
Yes,
and
correct.
They may or
may not even notice it, yeah. Yeah.
Wow. So and plus I was thinking about people with CPAP when we had all the power failures during the ice storm.
Yeah.
That's got to be scary for someone.
Yeah, certainly. There was that. There's been some issues with mold growing in some of the devices that happened a couple years ago and stuff. So there are definitely problems with the device that can occur in certain patients.
A sleep study. So you go to the hospital or to your office or to a sleep study place?
Yeah. So you talk to a sleep medicine doctor and they can get you set up with either a home sleep study where you take the equipment home and do it, which is pretty common, or you can actually have an in-lab sleep study where you have it done at the hospital itself. Either of those would work for qualification for the device. It just has to be within the last 2 to 3 years typically. We just want updated information because if something has changed, we'd want to know that.
Yeah, I always saw a sleep study was you go to the hospital and there's all these people with clipboards behind the glass.
Right, watching you.
What's he doing with his hands? So you don't even have to do that?
Not necessarily, yeah. If your sleep medicine doctor agrees, you could have a home sleep test and just do it from the comfort of your own house.
Will it reduce snoring?
The device, yes. So the device was approved about 10 years ago now, FDA approved, and 91% of patients had very high satisfaction at 5 years. It does reduce the AHI number from an average of 30 events per hour to less than 10. And it also improves your quality of life quite a bit as well. So people are a lot less tired and it does reduce snoring.
It's a new lease on life.
It can definitely be for some patients, yeah.
95% satisfaction rate.
Yeah, 91%. Yeah.
91%,
So
that's pretty awesome.
Still pretty good.
All right, so if someone's interested in exploring Inspire as a potential option to treat sleep apnea, what would be their first step?
Talk to your sleep medicine doctor. So if you're at that point where you're thinking about it, you probably would have had a sleep medicine doctor that you were established with. So talk to them. I've partnered with the ones in the community so they're well aware of the device. So they can point you in the right direction. The first thing is just to see if you're a candidate or not. And then if you potentially are, they'll send you on to my office where I'll have a consultation with you.
Awesome. Well, I'm sure there are viewers that this will be of very high interest to. So we appreciate your time.
Yeah, thank you so much for having me on. It's been a blast.
Good to see you. I hope to have you back.
Absolutely.
Dr. Syed Ali is ear, nose, and throat specialist at Henry Ford Jackson Hospital. We've got lots more great